$100 million in cuts from one of Kansas City's largest employers. We first told you last night about the cuts from St. Luke's health system. Now we're digging to try to find out why. Lindsay Shively has continuing coverage with what she's found. Lindsay?
Mark, St. Luke's employs more than 9,000 people, and that number is going to shrink according to their own documents. The hospital documents we have say healthcare reform is the reason for pushing these changes. So we asked experts how healthcare reform is affecting any hospital's bottom line. Internal St. Luke's health system documents obtained by 41 Action News state $100 million in cuts will be made because of future changes in health care and anticipated decreasing reimbursements. The newsletter employees of St. Luke's hospitals received Thursday listed the reasons they had to react now: health care reform and declining reimbursements.
Make no mistake, there are significant reductions in Medicare and Medicaid payments to hospitals in the ACA.
Dave Dillon with the Missouri Hospital Association also explains that the federal government is reducing funding to hospitals that was used to offset the cost of caring for the uninsured, called disproportionate share hospital funding. Reductions start in 2014. In Missouri's 2013 budget, Dillon says the state will receive $784 million in DSH funds.
However, the ACA significantly expands coverage through health insurance, both commercial health insurance and through Medicaid. And so what we're seeing is basically, and it's not necessarily a one-to-one, but an offset in the folks who traditionally have relied on hospitals but been unable to pay, now being able to, while these other series of cuts are going on.
Business as usual is not acceptable.
Doug Henley, the president of the Academy of Family Physicians, says hospitals across the country need to be more efficient and trim the fat, focusing on outpatient care.
We don't have a healthcare system in this country. We have a healthcare enterprise, and it's kind of uniquely designed the American way. It costs a lot of money. It makes some people a lot of money, and it certainly hasn't delivered on the promise to the American people of improved quality and cost efficiency of care.
St. Luke's representatives are not ready to talk on camera and say they won't know how many jobs will be affected for weeks. We have those St. Luke's documents. If you want to read them, just go to kshb.com. They're right on the homepage. We're live. Lindsay Shively, 41 Action News.